Welcome back, everyone. And we are in week 4 of our Mental Health Awareness Month. And this week we have the wonderful Kasey Pacheco, and she is a registered nurse and the owner of Preservers of Life, and has a wonderful YouTube channel, which is called The Spark of Love. I will make sure to link all of that information down in the description below. So welcome, Kasey. How are you today?
Thank you, Giselle. Thank you for having me. I am doing wonderful today.
Well, I'm glad to have you here because you actually hold a very unique space in nursing and in healthcare with your business, Preservers of Life. And I'd like you to share a bit with the audience about what you do and what makes your business unique.
Absolutely. So, like you, I'm a nurse entrepreneur and I'm an innovator. So, what my business is after the pandemic, well, during the pandemic, I realized that our society was really dependent on people deemed essential workers. Yet, usually, essential workers or the people who fill that space, they have really little access to healthcare for themselves. So I built a business model really catered to helping them as individuals proactively and preventatively. Usually small business owners, they don't have access to great health insurance because they are usually a smaller team. So I wanted to have a community inspired program where small business owners can get a wellness or an employee assistance program where they can have an outside healthcare source explain to them wellness, health, and just cost effective ways to care for themselves and the employees if they do have some.
Wow, that's a very nice business model and also framework for the community. So if you are a small business owner or an individual who is looking to, prevent mental illness or prevent physical illness and take a holistic approach, Kasey here can certainly help you with that. And how did you get into this type of work?
Yeah, so this I've actually been working with a lot of nonprofit organizations, and I realized that within the community there is no real collaboration between nonprofit and the hospital system. So when we discharge our patients and they're in the community, there is no in between to help them facilitate. So I saw a need and I went right for it.
That's awesome. Very, very good. You're a go-getter. That's great.
I am.
So we're here for Mental Health Awareness Month, and so we're focusing on personal mental health care journeys and things of that nature. Do you have a personal mental health care journey to share?
Absolutely. Mental health is something that in my community, it's not talked about enough. Usually, when people have mental health problems, it's so easily to be dismissed as a spiritual problem. You pray to God and you get over it. When I was pregnant with my son, pregnancy, it does a lot with your hormones. It can even exacerbate any mental health problems or just subliminal things that you just dealt with. So during my pregnancy, I did not want to end up with postpartum depression. So I really went in on it preventatively and proactively. And I really saw a big help. I really saw how it really helped me as I went through the pregnancy and even after doing meditation, affirmations, like really journaling, all the proactive things. It really helped me not spiral into depression postpartum.
Wow, that is amazing. So you actually used your own preventative care practices to prevent yourself from getting something like postpartum depression. That is very, very wonderful that you were able to recognize that you were at risk for something like that. A lot of people don't understand or don't realize that pregnancy is actually a risk factor for depression, of course, postpartum depression. So you use journaling, meditation, and what else?
I did affirmations.
Affirmations, yeah,
And
that's wonderful. And so are these the type of things that you do with the clients that you serve?
absolutely. I have a program, a visit type, an encounter called emotional release. And it allows the person, I use aromatherapy and I do it in a natural setting. And it allows the person to really express themselves, what they're going through, what their struggles are. But also, as they're expressing themselves, I'm writing up a nursing care plan for them. And included in the care plan are some holistic ways they can deal with some of the emotional things that they're going through.
Wow, that sounds very comprehensive. And is this something that you offer to all of your clients, or is this individualized?
This one is individualized.
Okay. And do you find that there are people who push back a little bit, or are there any stigmas that you have to come up against with any of this emotional release program if you want to integrate it for clients?
As far as stigma, I think the patients, they really want it. What I have found in my practice, see, I am not my specialty is not just mental health, I'm holistic. So I deal with every part of them, but I want to have a good relationship with the people that I refer. And what I have noticed in my community is that the resources for mental health are very scarce. A lot of my clients, a lot of the people in the community, you'll find that there are resources that they point the clients to, but if you just do a Google review, you would see the reality of those resources very harsh or not really existed.
Wow, that is so true. And actually, you and I did an interview on your channel, which I'll make sure to link to down in the description here, where we touch on some of those disparities out in the community and some ways that we can overcome those barriers working together. And so that's wonderful that you take this holistic approach, you include mental health. You know, what I keep preaching out there to the world is that mental health care is a daily practice, and you actually incorporate this into your clients' care plans, which is amazing, which is wonderful, and which is what every nurse should be doing. You don't have to be a nurse practitioner to include emotional well-being and mental health care into a care plan. You can do that as a nurse, like Kasey. You can do it in a business form, like she's doing through her business, but you can also do it in your care plan if you're working at an office, if you're working in a hospital setting. Certainly make sure to incorporate the person's mental health care and well-being into the treatment, and you'll find that you'll get more positive results and outcomes when you do so. Wouldn't you agree?
I do agree, and if I may add to that, something that I realized coming out of a clinical setting was that my mental and emotional health had to be stabilized for me to even really bring it up with my patients. So for me, it's really important for me to ensure that I am okay mentally and I am in a mentally healthy environment so that I can promote that with my patients.
That is a good point, Kasey, because when we don't take care of our own mental health care, we can easily be at risk for burnout, because in various nursing practices, facilities, it's a high stress role and a high stress job. So that's a great point, that whether you're a mental health care provider or just a healthcare provider out there working in a facility, running your own business or practice, if you don't put your own mental health care first, then you are going to be at risk for burnout, at risk for mental illnesses, anxiety, and depression, and many others. However, if you incorporate preventative practices like Kasey is talking about, you can actually build resiliency against those illnesses and build resiliency against physical disease, as well as healthy well being and mental health well being, equates to a better physical health and better physical outcomes. So that's wonderful that you brought that out to everyone here today. And for our audience, do you have any tips or things that you would like to give them for mental health care?
Yes, I agree with you that mental health is a daily practice. My tip will be when it comes to mental health and trauma, it can sometimes be a little bit heavy and scary. So, something that I would say is not to be afraid to ask for a lighter introduction to caring for your mental health. And I think as channels like yours come out, Giselle, we can incorporate mental health care and mental well being in innovative ways that is not so heavy and not so daunting for someone. But something I really talk a lot about is play and things like adult coloring or art, dancing, drama, like all of these things, they can help you with your mental health, music, in a way that is not just so heavy. I don't know if heavy is the only word that's coming to me, but it's not so heavy. It's not so, going back into a really dark space, but actually moving forward with light and love and freedom. And I don't know if that's making sense, but what I'm trying to convey is there are different ways to address mental health in a way that is not burdensome or traumatizing.
Yes, you explained that very well, actually. And I know what you're talking about as far as when patients have a lot of traumas or anxieties or have when their mental illnesses seem to be overwhelming, there are things they can do that are not so clinically based or not so challenging to look at. Like you said, there are things that you can do like coloring and play, just things that you enjoy, going back and getting into that. I actually had a comment come in on LinkedIn from someone who was struggling with their mental health care, and they used art and they got back into art and painting, and it really helped them to feel better and boost their mood. So, yes, there are very non conventional ways of supporting mental health and well being, and it doesn't have to be regimented or by the book. You can go outside of the box and do things that you love. That ultimately will help to promote mental health care and well-being. So thank you for that tip. That's awesome.
You're welcome.
And thank you so much for being here. Do you have any last words for our audience to share?
I would say definitely for audience out there, please support our YouTube channels. And by sharing the education that you've gotten, we are working all in our heart space. I know, Giselle, you labor over these videos, and it's something that I am grateful for. You share things, you're an excellent educator. And something as simple as if you find benefit from this video, just sharing it, passing it on, I would definitely, that's something I would say to the audience out there. Please share because it's a tough conversation to have. But if by sending education through social media, we can empower our society, it is a very beautiful thing to do.
Absolutely. Thank you for that. And also sharing your content as well. You have a broader content as far as preventative care goes. So Kasey goes beyond mental health care and goes into a lot of physical healthcare aspects and preventative aspects with diet, nutrition, medication management. So definitely check out her channel, share those videos if you find them useful, because the more people that are educated and the more people that know about healthcare in general, the more that people will be empowered to make well-informed decisions about their care. And that's the goal of this channel and the goal of both Kasey and I, to just spread the love, spread the healthcare news out there so that everyone can live a healthier and well-fulfilled life. I thank you all for watching, and I look forward to seeing you all next week.